Hi, everybody, and welcome to another episode of Biting into Healthcare with me, Dr. Miguel Stanley. As always, it's been a while since I've last posted. I'm probably the worst podcaster in the world. And moreover, I don't really think these are podcasts because it's just me sharing some ideas to colleagues, friends, patients around the world, people within healthcare. Those that are looking for more answers around the topic of oral health and systemic health, and probably also notes for myself for the future, because I'm always learning, always bringing out new things, connecting more dots. And it's been a while since I last posted something, and today I'm going to actually film this and put it up on my YouTube channel. Quite frankly, I've been just terrifically busy with my team here at the clinic and been lecturing in a couple of places. Earlier this year, I was in Santa Barbara, California, with the Seattle Study Club talking about immune dentistry. Then I went to Boston, and always flying back to the clinic. Heavy days at the clinic. I work about 10 to 12 hours a day here at the clinic. I'm always doing surgeries, applying the new acquired knowledge practically in the clinic, but always based on our experience. So, we're never inventing stuff. We're just fine tuning, and we've been fine tuning here at the White Clinic for 24 years. Whenever something novel comes out, you hear something on social media, or there's a new buzzwords going around, or new topics, new hot topics. We practice a lot of caution, and I like to really understand how that knowledge can be applied in the field. So today I wanted to talk about the mouth-body connection, and talk a little bit about some buzzwords like the oral microbiome, and try and just put a little bit of insight into what I'm seeing and what I'm learning, and what I think needs to be part of the narrative and part of that discussion. For again, these podcasts are for patients, for the public, students, dentists, doctors, humans. So a little bit of context. If it's your first podcast with me, I'm a dental surgeon. I've been doing surgery since 1998. Probably now 1996 if you count dental school. So I probably pulled my first tooth out in 1996, and that's a long time ago. That's a long time ago. And here today at the White Clinic, we've got a team of almost 50 people, but only 7 dental units, only 7 rooms, treatment rooms. So very low volume clinic. There's only one place where I practice here at the White Clinic, despite having a license to practice in the UK and Dubai. I only practice here at this clinic, where I love my craft, and because I've been challenged in the last 20 years to go and give lectures around the world, and I know that there's always thought leaders and professors, PhDs and scientists in the meeting rooms, and those that are organizing these congresses. These are people that know their stuff, so you can't just rock up and not know your stuff. You can talk the talk, but you've got to walk the walk. And I would liken it to I don't know, somebody that's in the back office during a wartime, giving orders to people, but has never actually been on the front line and never understood the battlefield. I know nothing about the army. I've never been in the army, but I've watched a lot of movies. So, but I guess that's what I say. If why is the U.S. military so strong? It's because it has the best weapons, the incredibly well-trained military. It's they spend a lot of money on their military. I believe it's the largest human organization in the world is the U.S. military, run out of the Pentagon in the U.S. And they've been at it for over 100 years, improving every day, outsmarting everybody, out investing everybody. And when you want a battle to be won, you're going to send your best soldiers with the best intelligence and the best technology and the best preparation. And what you really want to learn from is the guys that are in the field at the very front line, because they will actually have a better understanding of what's going on, not the people in the Pentagon, despite all of the experience, of course, but they even those guys want, give me the intelligence, give me the intel. So I am what you would call a wet-fingered dentist, a wet-fingered surgeon. That means I practice every single day. And much like a martial art or surfing or sport, I don't know, it's something you need to do every day. And I've been doing that every single day since 1996. And very, very lucky to be able to always be learning new things and acquiring new technologies, new techniques. So whenever something new hits the market, we can test it, we try it, we learn about it, we go and learn from the guys that designed it, that make it, not just some local distributor that's trying to sell a product for a commission. We actually go and speak to the people who invented it, made it, and designed it, and the CEOs and the chief marketing officers, the chief design officers, but most importantly, the chief technology officers, and see, is this good for our patients? Can this help on the front line, which is actually, in the operatory when you're with your patients? So I think it was Malcolm Gladwell in his book, The Outliers, spoke about, the 10,000 hours that you have to accrue to be good at anything. And I've probably surpassed that a decade ago. So, when something comes out, we can immediately understand and perceive its added value in the operatory when you're doing dentistry and dental work. So teeth are not just about beautiful smiles and aesthetics and having nice, straight, beautiful, pearly whites, which is a huge business, a huge part of dentistry, and mostly what the public will perceive as being good. But we need to break down what the public is. So first of all, demographically, you've got your Gen Zs, your millennials, your Gen Xs, your baby boomers, and your senior citizens. Just age-wise, because these people would have had different types of dentistry performed on them over the years, or there's a huge part of all of those demographics that have never needed to have any dental work. So, in some nations, preventative care, good oral hygiene, people from, wealthy backgrounds that have always had access to premium healthcare and prevention programs and good quality food and organic and biological diets, brushing since they were babies. That obviously, that part of the demographic don't even understand why dentistry is important, because all they would ever need is maintenance programs, visit the dentist twice a year for a checkup, and that's that. But then you've got the other side of the equation, because the planet's a very big place, and somebody that is 60 years old that started having tooth decay because of poor diet or poor prevention programs, and started having tooth decay when they were 10. So if somebody's 60 when they were 10, that was 50 years ago. So that would have placed them in the 70s. So let's say that they went at the age of 10 and had a filling done in the 1970s on an adult tooth, because your adult teeth start coming out when you're 6 years old. So there's a bunch of people right now that would on the planet that would have fillings done 50 years ago in their mouths. And let's say that filling, some of those fillings didn't, last the entire, because they weren't really well done. Back in 50 years ago, dentists didn't really know what they were doing. We were still learning. And not just that, some dentists are great at their job and some dentists are not that great at their job. I mean, that is true in every profession. You've got great carpenters, you've got terrible carpenters. You've got great chefs, you've got terrible chefs, and you've got great chefs that have a bad day. You've got, we're human beings. You've got dentists that are incredibly knowledgeable but lack the resources. You've got dentists that have no knowledge and all the resources. I mean, the combinations are huge. But let's get back on point. So let's say that now we're in the mid-60s and that filling, the patient is now 15 years old and that tooth needed a root canal. So the root canal is performed somewhere in the mid-60s and it lasts another 10, 15 years. And now we're in the late 80s. The patient's now mid-30s, has that tooth extracted, has one of the first early stage implants placed. And then lasts another 15 years. Another patient's mid-40s, and it's now the mid-noughts, has that implant replaced for another one, and other teeth start failing. And today, that patient is 65 years old, has, had a successful career, has got a bit more money, wants to invest in their mouths, but more importantly is investing in their checkups because they want to live a bit longer. So they've got a nutritionist, they've got a personal trainer, they've got, a psychologist, they're doing regular checkups, they're doing gastro, they've done a colonoscopy, they're heart specialist. All of these specialists are, and there's some issues with the health. There's some issues, there's some, there's some skin issues, there's some chronic fatigue. We all know, if you just look at the data, that chronic issues, health issues are just on the rise. I mean, between 6 to 9% growth a year. According to the Lancet, there were 18 million new cancer patients in 2020. And according to the Oxford University, in a recent poll, 1 out of 10 every individual has an autoimmune disease, which usually has inflammation at its inception. Everybody, is concerned about the gut and gut issues, and there's a lot. People aren't as healthy today as they were in the past, and the consensus from, let's call it mainstream medicine, is that it's the diet. It's we're having the low quality nutrients in the food, over farming the land, the quality of the nutrients isn't as good, and also the pesticides and the packaging and the way we, processed foods, cheaper foods, sugar-rich foods, and naturally, lower income families tend to have high foods, high processed foods, and a lot of sugar content. So it's quite a tragedy, all of that. And of course, that is all true. And then you've got your forever chemicals and microplastics and pollutants in the air. And I'm not a fearmonger, but yeah, the world is a little bit more toxic today than it was 30 years ago. But let's get back to this imaginary patient who's 65 years old and is trying to stay healthy and had that first filling done in the 70s. So let's take an X-ray at that patient's mouth today. And what are we going to see inside a full mouth X-ray? What are you going to see? And I see this every day here at the White Clinic. What am I seeing? You're seeing lead mercury fillings that were done 40 years ago, sometimes 50 years ago, that have long lost their capacity to do their job because of wear and tear in the mouth. So now they're releasing the mercury particles, and mercury is a well-known neurotoxin, and there's a lot of evidence to support this. And naturally, we now know that, and most good dentists in first world countries don't do mercury amalgam fillings for many, many years now. I haven't touched the stuff since the 1996. However, because these fillings are there, patient doesn't really care about the aesthetics. There's no pain. And the dentist that is checking this, is probably trained to say, look, it's fine. It's doing its job. It's a nice guy. But that's there. So that's problem number one. And then you've got some, let's say 4 or 5 root canals that were done 30 years ago without a rubber dam, without proper isolation, without any form of sterilization of the instruments, because that's not what we did 30 years ago. That's not how we were trained to think. We were trained to think more about the mechanics of dentistry, not about the immunological effects of this. And if you actually take it down to the core essence, a root canal is neurosurgery. Why? Because we remove the nerve from the tooth. And, you can debate that, but there inside a tooth, you have the pulpal chamber, and that pulp chamber has a vascular system, lymphatic system, and a nervous system. And your teeth are connected indirectly to your brain. So one of the largest nervous systems in your body, the trigeminal system, is directly connected to the teeth. So if you're using a non-sterile instrument to take a nerve out, just think about it, what that's going to do. And even today, the success of a root canal is deemed by a before and after film X-ray or digital X-ray, but a small X-ray taken before and after that shows that there's no signs of inflammation around the tooth, but it's not a biopsy. So there's no absolute certainty. It's just an X-ray understanding that things seem to be better. And obviously pain goes away, everybody's happy. But is pain, or should pain be considered the primary and only goal or the only form to is that success, having no pain in a tooth? Or is it having no pain and having bacteriological or pathological, no pathologies around that tooth, in and around that tooth, because the tooth has thousands of little micro canals inside it where bacteria and fungus can reside. And if you are doing a non-sterile root canal 30 years ago, that microbiome, that microclimate, that pathological microclimate literally resides inside the tooth your entire life. And there's no way you can get it out because it was inserted there inadvertently by a well-intentioned dentist. So naturally, a good root canal, and I did a podcast recently, about that, and well done with proper sterilized instrument with a good specialist, done in the last decade, let's say. And a good specialist will use a microscope and his instruments will be sterilized and he'll use a rubber dam. And that's something that can arguably be a very good treatment. But even then, it will have a finite lifespan. I mean, even the best root canal will not last 30, 40 years. So we have to think about that. Only a healthy tooth can last you your entire life. I mean, nowhere else in the world do we expect a prosthetic or a intervention to last a lifetime. I mean, even a Boeing airplane that costs $150 million will only give you a 1-year guarantee, and it needs constant maintenance. A roof, a brand new roof on a house probably lasts you, 60, 70 years. A car has a 1 or 2 year guarantee. A Rolex watch will give you a 1 or 2 year warranty. So everything has a finite lifespan, and healthcare is no longer no different. An artificial hip, they say you need a revision surgery roughly every 15 years. Just the hip revision surgery industry in the US alone is worth roughly $6 billion a year in the US alone. And you will start seeing the conversion of those hip replacements going from metal hips to ceramic hips. And that's happening. Why? Because we're learning new things. So, medicine is not an exact science. There's so many variables, like I explained before, the quality of the doctor, the quality of the materials, the training, the time. For those of you that know, I created the Slow Dentistry Global Network, inspiring dentists to take a little bit longer to do the right thing. But if you're in a clinic, no matter how well-intentioned you are, if you're in a clinic that mandates you can only have 20 minutes to do a treatment to keep costs down, there's no way you can do high-quality dentistry, period. And no dentist on earth can argue that point. No matter how good you are, no matter how many diplomas you have, no matter how much success signs you have, it's impossible to do a high-quality root canal in 20, 30 minutes. It's impossible, period. So that patient who's now 65 is trying to connect the dots to a systemic health issues. Is like, well, what's wrong with me? And they go to the dentist, a normal dentist, a good GP, whatever, and they're looking at all of this dentistry, not teeth, dentistry done in the past 30, 40 years. Probably the dentist doing the checkup actually did most of that work and say, look, everything's fine. Because who likes to critique their own work? This is good. This is my work. I'm happy with it. And that's where we are today in healthcare. So I wanted to just talk a little bit more about that, because perhaps there is a missing link between the mouth and the body. And most of these dentists or healthcare providers on social media today, they're talking about microbiome, which is a huge buzzword right now. And recently, Dr. Huberman spoke about it on a podcast. He's got millions of followers. It was great. He was talking about the importance of the oral biome in relationship to the gut and the brain and how we could improve that. And I thought it was phenomenal that he highlighted this. But that's all true for a person who's got great teeth, minimal amount of dentistry, and that dentistry is good quality. What about everybody else? What about those patients that have terrible dentistry or outdated dentistry or dentistry that's failed because it was done 20, 30 years ago, and the patient oblivious to the fact that there's a really toxic microbiome there with fungus and bacteria, that shouldn't be in the mouth, but is there because the restorations have no longer the proper fit. So there's areas where your brushing and rinsing can't get under. So you've got these caves or these areas, these nooks and crannies in and around your dentistry that these micro gaps, let's call it, that seem micro, but for a bacteria, it's the Grand Canyon, and they're hosting a wide array of treatments. I'll give you an example. A dental implant placed 20 years ago has a crown that is screwed into the implant. And if that crown if the fit isn't micrometrically perfect, you will have a micro gap that can cause leakage and retain a whole host of pathogens that just live there. And if you don't have constant maintenance there, that's causing serious disruption in that microbiome of yours. So I think it's very, very important that we take notice that there's a huge difference between patients with good teeth when we discuss microbiome. So you're looking at your Gen Zs, your millennials, and your healthy Gen Xs that haven't really gone a lot to the dentists, and even baby boomers that have always had the luxury of having good teeth. But we need to address, let's say that's the tip of the iceberg. It's what's under the water that's the bigger part of the problem. And that is those patients that have a lot of failed dentistry in their mouths. And that's what I wanted to talk about today. And if you are looking for problems in your, there's something missing in your energy levels, in your health, in your body, and there's something missing, then we need to start looking a little bit deeper into the dental treatments that you've had. And that's where probably second opinion will come in, not just to have dental x-rays performed, but also CBCT, cone beam computer tomography, which is a 3D rendering. This technology has been around for 30 years. The modern CBCTs are digital, are incredibly low in radiation. A new CBCT, like the one we have here at the clinic, has less radiation than a flight from here to London, and I live in Portugal, so that's in a 2-hour flight. So it's very, very low dose radiation because it's digital, and these new machines have metal artifact reduction technology in them, some AI built in, and they can really help a well-trained dentist to see things differently in and around your old dentistry, as well as your natural teeth that you would miss in a 2-dimensional film X-ray. So if you have a lot of dental work done in the last, decade or 20, 30 years, then most definitely go get a CBCT done at your local provider. And if your dentist doesn't have one, find a dentist who does, because that's a very, very important piece of technology. Recent censuses will show that only 34% of dental clinics in America will have one of these technologies, which is kind of crazy considering that it's one of the wealthiest nations in the world. So I hope to see that market grow, and that the CT technology becomes ubiquitous. We've been working with that here at the White Clinic in Lisbon since 2008. I was told that when we got it, only 1% of dental clinics in Europe had a CBCT, and we are now currently on our 3rd generation, and it is a vital weapon in comprehensive diagnostics, and you just can't do a full mouth checkup without one. So those little small film X-rays can help, and we also have those as well to make sure we're actually seeing, because they're high concentration X-rays in a small area. But the CBCT, without a doubt, is very important if you have a lot of old dental work, and also the correlation between health problems, systemic health problems. That is why I actually developed a artificial intelligence called Missing Link. I'm just going to do a little plug here. So you can just Google Missing Link AI, or just go to missinglinkai.com, and it's the world's only artificial intelligence destined to scan panoramic X-rays, that full mouth X-ray, film X-ray, to highlight or to screen. So it's not a diagnostic, but it will screen if you have any potential issues around natural teeth, impacted teeth, or dental work. And if you do have something, it will highlight it. It will generate a very simple report, and then inspire you to go and get a CBCT. And if you do have any infections, get that out as soon as possible, because there's an absolute correlation between toxic dentistry, bad dentistry, failed dental work, but also naturally occurring. I mean, you can have an impacted wisdom tooth that is got an infection around it, causing no pain whatsoever, huge cysts in your jaw without you knowing, that can go overlooked. I'll give you an example of a patient of mine who was 34 years old. She was very, very sick. She had skin rashes. She had chronic fatigue. She had super bad migraines. She couldn't keep a job. She was suffering. She had depression as a result of this. She had a bunch of doctors, and she was on the NHS in the UK. So obviously she was running around different specialities. She had a skin doctor for her skin. She had a neurologist for her brain. And they couldn't find out what was wrong with her, to the extent that after a year of trying to figure out what was wrong with this poor girl, she actually had a PET scan on her brain. They wondered if she had, neurological disorders. Nothing, came up clean. So they were all left scratching their heads. And she did have her dentist on the NHS that had been treating her since she was a kid. And she only had 2 small fillings done. So there would never been a need to take a more comprehensive x-ray of her mouth, according to the NHS protocols. So she came here to the White Clinic. We took our CBCT, which wouldn't be allowed in the UK, let's put it that way, because there would not have been an indication, because she had no toothache, no tooth problems, and her dentist said everything's fine. But of course, here in Portugal, luckily we're allowed to do that. So we took the CBCT, and she had a cyst the size of an egg around an impacted wisdom tooth. And that was causing all of her problems. We removed it with our special protocols that we have here at the clinic, using lasers and ozone and PRF and hyperbaric oxygen and all of that stuff, which is a whole nother podcast. And needless to say, a week after the surgery, all of her symptoms had gone and never came back. So again, there's a massive missing link in healthcare, and it's not the mouth-body connection. It's not oral health, systemic health. It's understanding toxic dentistry, poor quality dentistry, hidden systemic inflammation, hidden oral inflammation, and connecting that to your systemic pathologies. And I really believe that there's when people are talking about oral biome and healthy oral biome and all of that stuff, I think in their brains they're thinking about people with great teeth, very little dentistry. And of course that's great, and it's all true. And it's important for the millennials and younger generations to keep a healthy oral biome, and all of that stuff is true. But there's a huge part of the population that's got this problem going on, and they're not getting the right diagnostics, and GPs, physicians, doctors just don't know anything about teeth. There's a huge lack of knowledge from the medical complex, the medical industry, in regards to dentistry. And when they think about teeth, they think about healthy teeth. And it's like the greatest magic trick ever pulled, is that somehow every doctor on earth thinks that every dental treatment ever done, ever in the world, was well done. I mean, that's just crazy to think that, right? It's absolutely impossible that's true. Or they also probably think that it all lasts forever, and that the only indicator of failure is pain. Pain, in most cases, is never a symptom in poor quality failed dentistry, or even like this case of my patient, Allison. She had no pain, and she had a cyst the size of an egg. No pain in her mouth. Her symptoms were everywhere else. So I guess the punchline here is we need to improve our diagnostic skills as dentists. We need to start doing full mouth diagnostics, not just one tooth. But if the business of the practice, if the mindset of the clinic is to see 20, 30 patients a day, that those are very small appointments, then you're just getting that small little x-ray, and that's not a full mouth diagnostic. So imagine you've got systemic disease, I don't know, fibromyalgia, chronic fatigue syndrome, these modern illnesses that aren't absolute diagnoses. They're a series of symptoms that put you in let's say rheumatoid arthritis and all of these things, or even cancer. And your doctor says, look, go see your dentist, get a checkup. All right. It's a suggestion, by the way. There's no prescription for that. Everywhere else in medicine, there's a prescription. Get this test done, give me the report. Get this test done, give me the report. Have that CT scan, give me the report. But going to the dentist is a suggestion. And the doctor, of course, doesn't know what kind of dentist you're going to. So let's say that patient goes to one of these clinics, these network clinics or whatever, that's got a 15-minute, 20-minute checkup. And the dentist says, does anything hurt you? No. Oh, let's look inside. Everything seems fine. Little x-ray, everything seems okay. Okay, get out of here. Your microbiome is fine. Your teeth seem okay. Your dental work looks okay. Bye. Completely oblivious to cysts and deep infections in the bone because they haven't taken the appropriate x-ray for that. And I think that that's a tragedy and that needs to change. So I don't know if the dental community or the dental business owners are ready for that shift, because it will change an entire ecosystem and workflow and pricing and insurance companies and all of that. But you, the patient, should start thinking about that. That's what you might need if you fit into the bracket of patients, that demographic that's had a lot of old dental work done. So you might want to get a second opinion with the CBCT. There's always somebody in your neighborhood that will have one. And that doesn't mean you have to give up on your dentist. Just go get a proper x-ray. I'll give you an example. Brazil. Most dentists in Brazil, one of the largest dental communities, if not the largest dental community in the world, with over 300,000 dentists, most of them will not have a CBCT. But because it's such a big country, you'll have CBCT or CT centers. You have them in London as well. So you can go and get a CBCT, get a prescription for one, and take ownership, take agency of your health, and go get that done. And if you are curious to see if you have anything, and you do have a panoramic x-ray somewhere in your files, a recent one, in the last 2 years, ask your dentist for it, and you can upload it to Missing Link. There's a small fee, and it doesn't ask for any data. It doesn't mine any data, and it will give you a screening of your x-ray, and then maybe help you connect some more dots between your oral issues and your systemic issues. And naturally, any good dentist, any good GP, a periodontist or oral surgeon knows how to get that inflammation out of your mouth. Even if they don't do the best job in the world, just getting that inflammation out of the mouth is going to reduce the production of chronic inflammation in your bloodstream, which will have an immediate effect on your entire body, your joints, your skin, your brain, your heart, your organs. People with fertility issues. I mean, everything's connected. If you are having health issues, you're an athlete, whatever, that your doctors can't seem to improve upon, then the solution could lie in your mouth. But make sure you get that CBCT. And if you don't know where to get one, sign up to Missing Link, and that can help you. All right. So I hope I shed some lights onto that. And I hope you all stay healthy out there. And I'll try and post another one of these soon with a little bit more exciting stuff about the mouth-body connection. Thank you. Bye.